Trigger warning, 3, 2, 1. We're going to talk about something incredibly sensitive to a lot of people. So please, if this isn't what you want to listen to, scroll along. I totally understand. I am often asked, how do I handle doing exams on patients, especially female patients who have a history of SA? And that's a very valid question. And the truth is there's no simple answer. And there's no one answer because it has to be individualized to that patient. If we just did the same thing for every patient with a history of trauma, we could cause more harm than good. Now, here are some things that I do make sure that are done consistently. I always offer a female provider. Most patients don't take me up on it, but the ones that do, no problem. That's what they deserve. If I'm doing the exam, I always have a female chaperone present, and I encourage them to bring their own support person, someone they feel safe and comfortable with. Beyond that, we have to make sure that we individualize our care to that patient, to their needs, and what's going on. Lots of communication, make sure that we can get consent at every stage of what's going on. And I make sure that they can stay fully clothed as long as possible. There's no need for them to sit in a gown for 30 minutes while we talk and ask all the questions. We do all the questions, do everything we need to. I step out, they switch into their gown, I come in, we do the exam very carefully, not to cause any pain, and make sure that we get consent. I step out, they change again. Additionally, we can always offer these patients something like Xanax or Ativan to help ease the anxiety before an exam as long as they have a driver to take them home. But remember, that might actually make it worse for some patients depending on their past experience. We have to individualize care for women. It's what they deserve.